Hi, this is Krista Stefani, and this training module will assist you and provide you information related to completing the Adult Day Health Service-Specific Worksheet contained within the Nebraska Department of Health and Human Services Aged and Disabled Waiver Services Cost Survey. This cost survey is being conducted to assist the department with performing a rate study as the rates relate to services provided within the Aged and Disabled waiver. To access the Adult Day Health Service-Specific tab, you must first navigate to the Services tab within the Cost Survey Workbook. From there, you'll either type or select X next to Adult Day Health and click on another tab. As you can see, then the Adult Day Health tab will appear. Click on that tab to access information being requested as it relates to providing Adult Day Health services. We realize that this information may not be easily accessible and readily available by your organization, and that's okay. We are asking you to populate this information with your best estimates based on your knowledge of the services provided for Adult Day Health by your organization. As you can see, we are requesting information related to current services, which relates to your fiscal year ended in 2021, and if you have the information available related to your fiscal year ended in 2019. If you can, please provide information for both of these time periods, as we would like to see what the difference in your service delivery is pre and post or during the pandemic. The first information we're requesting is you to identify the number of individuals who receive Adult Day Health services from your organization. From there, we would like you to indicate the number of days per year you provide services by your organization. If you are open and provide services 365 days a year, you would indicate that on this line. Otherwise, if you are only open and provide services during weekdays, please calculate the number of weekdays that are available during your fiscal year ended in 2021. We are also asking you to calculate or provide the average number of days per year a typical individual participated in the service. We realize that not all individuals access service every day that you are open. Therefore, we're asking you to provide the average number of days per year an individual participated or received Adult Day Health services. The next item is asking you to provide the number of hours per day services are provided. So for example, if your agency provides Adult Day Health services from the hours of 8 a.m. to 5 p.m., you would indicate 9 hours in this field. The next question asks for you to provide the average number of hours per day a typical individual receives services. We realize that not all participants may access a full business day for services. They may come in for only a portion of that day. Based on your knowledge of service delivery, please indicate the average the average hours per day an individual receives Adult Day Health services. Also, to assist us with evaluating rates related to Adult Day Health services, we're asking you to indicate as a percentage of the total services that you provide, what percentage of individuals receive less than 4 hours of service per day, and what percentage of individuals receive 4 or more hours of service per day. As you can see, there is a message that pops up here if the total in these two cells does not combine to equal 100%. If we were to use the information included in the example column, you can see that error message disappears. Please ensure that those error messages are not present when you submit your cost survey. As stated earlier in this module, if you have the information available related to your fiscal year ended 2019, please populate this section as it relates to providing services prior to the COVID-19 pandemic. The next questions ask if you provide adult day health services in a group setting. What that means is you have one direct support professional providing services to more than one participant or individual at the same time. If that answer is yes, select that response from this drop-down menu and then indicate what your typical group size is. So for example, if half of your services are provided in a group setting of one direct support professional with 3 individuals, and half of your services are provided with one direct support professional and 2 participants, then your average group size would roughly be 2.5. You would indicate that in this field here. The last questions we have related to adult day health is for you to provide information related to staffing ratios. We want you to indicate the percent of your total services that are provided in the various staff to individual ratios pre-populated or that you may populate if the appropriate staff to individual ratio is not listed in lines 17 through 20. So remember, the first number is your number of direct support professionals, and the second number is the number of participants. So for this first line, if you have 2 direct support professionals providing services to 1 participant or individual, you would indicate that percent of total services here. If your services are provided on a 1-to-1 or a 1 staff to 1 individual, you would indicate that percentage here. Please continue to populate this section of this worksheet until you have accounted for 100% of your services. We thank you for taking time to complete the cost survey and also for taking the time to review this training module.